This week is Brain Tumor Awareness Week. Brain tumors are one of the few cancers that can strike at any age. About 17,000 people are diagnosed with cancer that began in or next to the brain every year in the United States. And most brain tumors are slightly more common in men than women. To learn more, we turn to UofL Health's Dr. Brian Williams. Dr. Williams, thank you so much for taking the time to come in and talk to us.
Of course, it's a pleasure. Thanks.
So let's start with awareness. Why is it so important to know about this and have this on your radar?
Well, even though it's an uncommon cancer, so only about 1% of Americans will have a cancer of the brain or a tumor of the brain, it's a much higher proportion of those people that might die from that cancer. And so it's critical that we diagnose it quite early and try to give someone the best options that they can have for the best outcome.
So certainly not a diagnosis anybody wants to hear. What are some of the warning signs that maybe you should go to the doctor and get it checked out?
Sure. There are signs like a new seizure if you're an adult, if you've never had them before, a new problem like moving an arm or a leg or a sensation, or maybe difficulty speaking. Even something as strange as maybe a progressively worsening headache or a new headache that's different than prior headaches can be the sign that you need to come in.
And is it okay to go to your primary care first? Do you skip right to the big guys? What do you suggest?
I think the primary care is the most important part of it. I think they're the ones who usually are taking care of the patient and diagnosing the problem. We come in as a secondary helper to sort of move along care and make sure you get the best outcome after we see something's wrong.
And I know you work with a really unique team. It's the Neuro Oncology's multidisciplinary brain tumor clinic. What makes this team so special?
The special part of the team is that you have so many different people involved from all different backgrounds, and the patient gets to have a buffet of everything that they need or want at that time. So it could be a surgeon, it could be an oncologist, it could be a chaplain, it could be a cancer rehab specialist. And by getting all of that at one time, the patient's able to have a better life while they're getting hopefully more life.
And what are some of the options when it comes to treatment, when it comes to the next steps after the diagnosis?
Well, it can vary quite widely for different diagnoses, and so there's 100 different types of brain tumors, and
Wow.
each one of them can have a slightly different management strategy, but generically surgery, radiation therapy, and chemotherapy are traditional cancer options, and we're exploring other options as well, like immunotherapy.
Wow. Well, really incredible work you do here. Thank you so much, and thanks for taking the time. I know you're a busy guy, and you're doing really important things, so we appreciate you coming on today.
Well, it's a pleasure. Thanks for having us.
Thank you.